Well, thank you so much. And I'm particularly excited actually to have a chance after I talk for a few minutes to have a conversation across the three of us, because I think, we continue to learn from each other and how to use our partnership to do our own work more effectively, how to translate across these fields that are quite complementary but different in the ways we think about space. So I'm really excited to have that conversation in just a little bit. But first, what I want to do is spend a few minutes talking about a project that I've been doing and with both Andrew and Hillary involved from the beginning in a community in Brazil. And so I think over the course of these last two presentations and throughout the conference, I think we've had a lot of insight into the ways that place may matter for health. So I'm not going to try to convince you that place can matter for health. But I do also think that there are a lot of ways that we've been surprised in our findings, and that's emerged over the talks already today, that we don't always see that our intuition about what's going to work will be right, that we need to continue to have feedback to understand better and better what is going to work in particular places. And so what I want to do is actually think together about and share some lessons about how we can adapt what we've been doing in settings like New York to settings where we may have less of a starting point in terms of some of the spatial data resources, where we may just be at quite a different vantage point at the beginning in terms of what are the challenges to health in the area. And in setting up this particular example, I want to point to one aspect of the future of place and health, and that's that we often think about the future of cities as being sort of the shining megacities, but we also know that there's an increasing number of people living in slums or townships, favelas, these informal communities that take different names depending on the setting. There are already 1 billion people globally living in informal communities, and these communities, almost by definition, have particular health challenges related to safe water, sanitation infrastructure, in building integrity and security, living in those settings. And so what I want to think about is how do we not just compare slum communities or informal communities to other parts of the city that have more resources, but how do we look at the variation within a given community and try to understand the ways we can nudge it to be a healthier place, the way we can better support people who are increasingly in these crowded conditions to have opportunities for health. The particular place that I want to focus on is the Rio das Pedras community that was already mentioned. And the reason that the three of us have come together around this community is in part out of the interest that the mayor's office had when we opened Columbia University's Global Center, and I think perhaps even before as the Studio X space that the architecture group has. We have these physical office spaces that are Columbia event spaces in Rio de Janeiro. And in conversations around launching those, we had a request for Columbia to bring together perspectives from engineering, architecture, public health that could help to inform what would be helpful for health in this particular setting. So this community, which is home to more than 60,000 people, is adjacent to the Olympic Stadium site in the west zone of Rio de Janeiro. So there was an interest in addressing some of the public critiques that a lot of investment was going into basically facilities for elite athletes when some of the basic needs of residents were being unmet. So for me, this was a really exciting opportunity to come into a situation where there was somebody waiting to hear the results of our research, where there was a political moment in which we might be able to make recommendations that would be heard, that would resonate. And so it was sort of in that context that we tried to figure out, well, how can we take what we've learned previously in studying how environments can be health supportive and supportive of people and pedestrians, and then bring that into a new setting and sort of dive in a time-sensitive situation where we had only a year and a half to come up with recommendations for the mayor's office. And so that's what I want to share some of my experiences in doing that. The first step was, of course, to build a partnership that went well beyond our own team in epidemiology, but that included links to the city of Rio de Janeiro, their health department, as well as other aspects of the city hall. We had also looked to the strengths across Columbia University. Already, even before we got the funding to move forward with this work, we were in conversation with architecture and urban planning. We were talking to the engineers, particularly sanitation engineers. We were trying to understand sort of what are the ways that the strengths we have in the School of Public Health, which has a focus on urban health, on the built environment, on understanding the health return on investment, what could we bring together with these other parts of the Columbia University in order to be as relevant as possible in our work in this community? We also wanted to make sure that we were responsive to the local context, and so in that way we partnered with academic leaders at the Brazilian National School of Public Health, ENSP, which is at the Fiocruz Institute, and had an opportunity to learn from their experience in assessing the health in an informal community that's adjacent to their school campus, and sort of to build on that in our own work. And then finally, within the particular community, we had an office space that was our base of operations for day-to-day data collection that was through the Center for Citizenship and Investigation. And this is a group that puts out the local newspaper and that is advocating for community rights. So we had built together this constellation of people with a wide range of expertise that had different angles on trying to look at what could be health supportive, what are the opportunities to better support health in this setting. We had funding for this work. What I'm presenting is only one slice of what Columbia's done in this setting, but presenting what we've been funded by Medtronic Philanthropy to do. And I want to just point to 5 ways that this work required us to be a bit creative in our troubleshooting as we went along, and to take things that we're used to doing, like sampling households or sampling space, and adapt that to a setting where we didn't have formal addresses, an established official network of streets that are named, that are recognized by the city. We needed to think about characterizing mobility and whether we could take these wildlife GPS-based approaches that had been used in New York City and use it in this setting. Would we be able to use devices like that? Would it be accepted? And finally, we wanted to make sure that we were responsive to the original ask from the city in terms of communicating not only as academics to our peers, but to the city and to the residents themselves. One of the challenges of doing this work in a dynamic political and economic climate is that things shift. And so I will also turn at the end to how some of the shifts within Brazil have informed where we're going next with this work. So first, in thinking about selection of households, what we decided to do, since we didn't have a list of phone numbers or a list of addresses that we could sample from, and we wanted to make sure we were getting a representative, sort of wide-ranging sample of the residents of the area, was that we used a grid overlaid on the area that we wanted to study, and then where the lines intersected, then tried to find what's the house nearest that location, and can we recruit from that place. This was a strategy to keep us from just taking the most convenient locations and potentially getting a sample that's very biased. So we did this. I'm showing a grid here. One of the themes that you'll hear me point to a couple of times is we have to be very careful about the data confidentiality for our participants, and so we can't show you the actual grid we used, because that would reveal the homes that we tried to recruit from, but this is sort of a representation of what that grid looked like. And likewise, on the left, there's a home, and you can see this number 3. This is not one of the homes we recruited from, but it's a picture that we took while we were in the area. And I just wanted to highlight that, there are these addresses, but as we were going through doing our recruitment, the city was painting over and making the addresses sequential along the street, and the residents were painting over and putting them back the way they were. And so we heard a lot of tension that I think reflects some of the tension between the informal community and the government. That is one of the things that came out to be, a very distinctive feature of working in this informal community, quite different from working in the New York City environment. There's a long-established tension between the communities because they haven't had access to services and haven't trusted the government to provide those services, that now when there's a lack of process to build and repair that trust, things like renumbering the addresses, which may have some justification, were met with skepticism and resistance. I also want to point out that some of the time there was no clear address equivalent on a given building. And so what we did then, as we got to the particular location we wanted to sample from, we took photos, we took notes. We wanted to make sure that our field team could get to the same location and could get there reliably, so that we could do things like give a GPS device that the Department of Health had kindly loaned us and actually get it back. We approached and talked with 108 households that agreed to give us some information about people living there. We found, relevant to the theme of this conference, that the age distribution was a bit truncated at the top end, more so than we expected. We had actually started conversations with the International Longevity Center in Brazil because we were very interested in the ways that informal communities could be more health supportive, more supportive of independent living late in life. And I think part of this pattern that we saw that, fewer than 1% of these 108 households had adults over age 65. I think part of that reflects a tradition of moving back to the northeast of Brazil. This is a community largely of northeastern immigrants from a different part of the country, and it may also reflect some of the challenges in living in and navigating this environment if you do experience any limitations later in life. And so I'm going to point to some of those potential barriers. In addition to getting information about the household composition, we selected one adult from the household, and we were able to interview 104 of those randomly selected adults and ask them a series of questions about their lifestyle, their health, and then asked them if we could take a sample of the water that they drink, of their tap water, and also if they could carry a GPS device for 4 days and we could come back and get it. And so we were able to get 96 water and saliva samples. We were able to get them transported to the lab, which was challenging because a courier service wouldn't take biological samples from this area to the lab. We had to have our own staff do that part of the work. We also found that there were some challenges in disseminating the findings around water because the militia that is predominant in this community is one of the distributors of the water. So I'm happy to talk more about working in that setting. We had 89 of our participants agree to carry a GPS device for 4 days, and one of the interesting successes was that we got every single device back, and we were able to return them all to the Department of Health, happily. And we also were able to use the maps that came out of using the GPS devices in our qualitative interviews with 14 of the residents so that we could try to better understand what it is that's serving as a barrier to moving through the community, how people understand the determinants for their health, what their ideas are for their own community. So this part of the work, which was largely conducted in collaboration with a set of 6 trained residents, was complemented by our effort to try to understand the streets themselves. We wanted to look at how this wasn't sort of one uniform area, but was an area with a lot of variation as you go from one street to the next. And so what we did was to take a set of 89% of all the street segments in the area, 643 street segments, and at each segment we answered a set of 20 questions systematically, things like, is there litter, are there sidewalks, are they in good condition? And then we also took photos of aspects of that environment that could undermine or support health. And so through that process, we got more than 4,000 photos that we're now looking at as a way to inform our future direction. So I'll come back to those photos. Combining across these different modes of data collection, one of the things that really stood out for us was that there were challenges to pedestrians in this environment, and those challenges were somewhat amplified versus what we see in New York. We've had fairly chaotic environments for pedestrians to navigate. We heard from one of the residents we interviewed, you have to pay attention because you have cars, motorbikes, bicycles, other people. So if you're walking with children, it's dangerous. It's most problematic on the side streets where many of the people want to drive their cars or motorbikes as though they are on the main roads. We heard a lot of concerns. We actually also, our field team that was taking photos on the different streets, several of them had notes about seeing near accidents while they were in the field. And so we had reason to think that there was potential for improving the experience of pedestrians in this area. But I think doing so would be complicated. We noted that there were only about 31% of the streets we observed with good condition sidewalks. And many of the streets, even that had commercial structures, that had a series of businesses that a lot of people would be visiting, each business had control of the sidewalk outside of their business, and the next business had control over that sidewalk. And so somebody might put in beautiful tile, somebody might have a different sort of concrete at another level, and the experience walking along the street was very disjointed. And so the collective action to just put in a sidewalk was absent from this environment and would be complicated, I think, given the sort of resistance that we were seeing around changing the addresses. So as we were getting the GPS data back, we were interested in the patterns we were seeing, and there's a lot of variation that we're noting in how much of the time people spend within Rio das Pedras versus out in the rest of the city. We're definitely seeing that some of the expected patterns of differences between weekdays and weekends that have been noted for many settings don't appear to be as similar in this setting. So for example, we see fewer people leaving the favela on Sundays, but Saturday doesn't appear to be that different from the other days of the week. And we heard from our community partner organization that for many people, they work on Saturday and they take off Monday. So some of the recommendations for GPS use, like get 2 weekend days and 2 weekdays, are complicated to implement if you can't assume a Monday to Friday 9 to 5 schedule. One of the other things that we were concerned about, given that these devices rely on satellite signal and signals from multiple satellites, were some of the very narrow streets. And I have to say that this is not at the extreme because the most narrow streets don't photograph well because they're very dark. So this is something that when we were walking around was just very salient in the experience of the environment, and that we worried our GPS devices wouldn't work. So back in New York City, what we did was then to say, okay, well, in this environment, we also have variation between places that are relatively low in terms of the building heights and places that have taller buildings, as you would picture in sort of Midtown Manhattan. So here, where you have low building heights, we could have people walk along the black line that's almost totally obscured by the paths traced by multiple devices over multiple people walking this path. So we are getting very good information. It seems to align with the truth quite often when we have these devices carried by actual study participants, we don't know the truth. So this was sort of just a very structured walk where we knew where they were going and had the opportunity to observe whether there was a lot of noise. The question was then, would we see more noise in the areas with tall buildings? And in fact, we did. It was pretty striking that we would, based on just joining adjacent points, we would overestimate the distance traveled by about double. So then if we're trying to go after some of the concerns raised by residents about differences between the side streets and the main streets, and look at questions about what paths people are choosing, it's going to be complicated by having this increased amount of noise in our understanding of where people are. I think likewise, if we think about some of the work we've done in New York City, if we're having this greater amount of noise in the areas that are highly built up, that have high retail floor area, that may be part of what we're seeing in our walkability studies, then we kind of need to figure out how to resolve this, figure out how to understand the effects on our research. I wanted particularly to bring this up also because it's a problem that we already had in our backyard, that we didn't think about until we tried to do this work in a new setting. And so I feel like it's been an unexpected surprise for me how much the work in Brazil has informed my thinking about projects in New York. I had always gone into it thinking about the other direction. So this work was just published last month in the American Journal of Public Health, and we have several other papers in progress where we are working on sharing our experience for assessing physical activity environments in this setting, for doing street observations relevant to climate vulnerability, looking at the water quality issues that people face in this setting. But importantly, these peer-reviewed publications, which are usually our first go-to before we start disseminating to local organizations like the health department, this was actually after we had started to disseminate what we understood, at least in draft form, to the city government. Because of the genesis of this project around the mayor's interest in investing in health, we were really energized to get something into their hands as quickly as possible, leveraging both the observations that we had made in the environment, what we saw in the peer-reviewed literature, and also data that was shared with us from the local health departments. One of the challenges is that even though Rio de Janeiro actually has a tremendous surveillance infrastructure, they have silos that I keep hearing about in every setting that keep the people in health from talking to the people in traffic and transportation, so they're not necessarily bringing this all into one place. The other challenge is that the health reporting areas in a city like Brazil, which has hundreds of informal communities, the health reporting is for either official neighborhoods, non-favelas, or for larger units, and it's very challenging. We had many conversations before we were able to get sort of custom maps and custom statistics on the Rio das Pedras favela, even though this is a large area that is serving 60,000 people. I do want to make sure to recognize also that while the stakeholders were sort of some of our initial conversations on why to focus on this area, the ultimate reason that that partnership was appealing is that we hope to make a difference in the lives of the residents. We want to use this sort of moment to create opportunities for their lives to be healthier. And so our very first audience, our first product of this project was a booklet that we were giving back to the residents, including our participants, but also more broadly through communication with the community partner and through work that was described and expressed in the local newspaper. We wanted to make sure that to the extent that we had information that could help people to protect their own health, that we would get that into their hands as quickly as possible. So not only for the residents whose water we sampled and found contamination, of course we gave that result back to them right away, but also for other residents to know that there were problems with the water contamination. And so an example of that was that we tested the tap water and found about 20% of the tap water had coliform bacteria, suggesting potential contamination. What households can do in that situation is to purchase water. They get sort of sparklet style or large bottle water for dispensers. We sampled that water as well, and that was 3 times as contaminated as the tap water. So we wanted to make sure people had this information, had tips that could keep contaminants from the outside of the bottle from getting into the dispenser and into the water, and would be able to raise this issue to advocate for change even after our funding had concluded. One of the things that's really sort of been a pivot for us in this work is that we've been looking at the environment, thinking about people, thinking about the chronic diseases that we study, heart disease, lung disease, cancer, obesity, because they are emerging threats in Brazil. However, we were doing all this work in the field in 2015, and right at the end of 2015, we started to hear much more about Zika as a huge concern, particularly for pregnant populations. And many of you may have seen these signs as you're traveling through airports, concerns about protecting yourself from Zika virus. And I think, the advice, don't let mosquitoes bite you, can only take you so far. We're always concerned, I think, in public health about the limits of advice to sort of protect yourself. So just in the way that individuals trying to protect their families in the context of potentially contaminated tap water, only could purchase the water that was available, trying to keep mosquitoes from biting you, you can only go so far without addressing sort of what is it in the environment that's leading to the mosquito population. And we know that the pregnancy complications related to Zika are most concentrated in the informal and lower resourced communities of Brazil. So this is, I think, a really crucial area for us to try to tackle, even though it's quite a departure from a lot of the work that we've done previously. Because people always ask about the Olympics, I do want to also say that Rio Olympics are in the wrong place. Rio isn't really the epicenter of this Zika epidemic, and they're at the wrong time because it's not the right season for the mosquito population to be high. But that said, we do want to make sure that we can try to shift the conversation away from this putting everything onto individual pregnant women not to let mosquitoes bite them, to addressing some of the problems that we saw for pedestrians that might also have a benefit in terms of controlling the mosquito population. So in thinking about this situation, what we needed to do was to expand our team. Luckily, our academic lead from the Brazilian School of Public Health was Maria Sá Carvalho, who is an infectious disease epidemiologist with a long history of studying dengue, which has been a concern in many of the same mosquito species, that makes it so that there's a huge base of research actually around the Aedes aegypti mosquito that has been such a focus. But the other thing that we needed was to understand how a mosquito would view these streets that we were assessing. And so we've partnered as well now with an expert in insects and how they look at the environment. So Nildemar Honorario has been helping us to understand, what would a mosquito see when they look at these streets. So things that we've collected because we're interested in the pedestrian environment, like litter and trash, we were seeing that it varies quite a bit across in terms of the form of what litter and trash looks like on different streets. And we wanted to know from our entomology expert, what the mosquito would see in these different environments. So we've been just starting to build our work with her And I love that she uses green for the environments the mosquito would view as favorable. So this would be a go for breeding. These areas with a lot of debris accumulated, they have excellent sites for the mosquito to breed in plastic containers, in bottles, in plastic bags, because so little water is needed. And it doesn't have to be persistent standing water. It can be a bottle cap that fills up in the rain, eggs are laid, the next rain, the eggs hatch. So it really can be something as challenging to address as the litter collection in these neighborhoods. On the other hand, if we're sending, as Brazil has, thousands of troops out into the streets to motivate people to protect themselves against mosquitoes and to address their indoor environment, perhaps we can mobilize some of that public will towards addressing the cleanup of the urban environment that's not in any one person's home. One of the other things that we noted about this particular favela was that there are, on about half of the streets, some evidence of construction. So it's a very actively growing and changing environment. And it was noted that these kinds of containers, in a way like the debris, could have an accumulation depending on how long they're present for. They could be mosquito breeding sites. Also, I was very interested to learn that the Aedes aegypti and the other Aedes mosquitoes prefer water that's relatively clear. So containers that fill up with rainwater are great from their perspective. Containers that fill up with very murky, highly contaminated water, or the canal where the sewage flows in this neighborhood, are attractive for mosquitoes, but a different mosquito. Not the mosquito that's been linked to Zika and chikungunya and to dengue, but also this mosquito bites humans. So there's a real challenge that if we address only the environments of one mosquito type, this Culex mosquito may take over and people may feel, I'm still getting bites, so is it worth the effort to sustain this activity? So I think there will be some decisions to be made about either communicating that more effectively or addressing multiple mosquito species in the environment. Finally, I think it's important to note that there were streets like this that our expert told us did not have potential mosquito breeding sites. And this variation from sort of highly probable mosquito breeding sites to possible or intermittent sites to absent would allow us to potentially map these opportunities for intervention. And we've started now, from partnering with an insect expert to partnering with engineers who have the app development and image processing technology to help take what we've done, having humans look at hundreds of streets and thousands of photos, and getting that to be more algorithmic, more scaled up in a way that it can be done faster and closer to real time. And so we're now looking to find the resources to bridge these different perspectives to get the interface with the Brazilian systems, the expertise on the mosquitoes themselves, and the technological abilities to deploy these approaches. And then from public health, I think what we can contribute is understanding then the health effects and evaluating whether this is working. So with that in mind, I just wanted to close by pointing to some of what I see as beneficial about the kinds of collaborations that we've had between public health and architecture, and more broadly kind of crossing our usual silos. From my side, I feel like Andrew and I are scientists, researchers, and we're sort of very much grounded in a tradition of observation and iteratively trying to get more knowledge. But I think that gets much richer and has the potential to be more relevant to real-world settings and more solutions-oriented as we partner with people who are more engaged in design and practice. So I'm really excited about the opportunities of those partnerships. On the other side, I think that we don't always see things playing out the way we expect suggests that we also need to offer sort of what we have in training in systematic and formal observation, assessing some of the assumptions that may go into design, that may go into innovative ways of changing places, to make sure we're really getting the benefits that we hope for, to make sure that those benefits are playing out, particularly for our most vulnerable communities, that we're understanding sources of resistance that may require us to correct, refine our strategies as we go. And so with that, I just wanted to point to some of the capacities that we do have in public health. Because I know this is a mixed audience, I thought it was a good chance to point to the fact that we have training in observation, analytics, mapping, in assembling the evidence from previous work that can help us to understand which strategies are most likely to be beneficial, to evaluate, refine, and adapt things from one setting to another. And then finally, to do some of the solutions innovation that Andrew pointed to, in partnership to help expand the kinds of actions that are considered to support health. So with that, I want to thank you for your attention and invite my colleagues to join for a conversation. Thank you.